Joining us now from Michigan, the former governor of Michigan, Rick Snyder, part of our efforts to talk to former governors who have lots of ideas about what can be done. One of my big concerns is so many of the smartest people in the country are not currently on platforms where they can submit ideas and help the public through this. So Governor Snyder was the governor of Michigan until last year. He's a successful business person, venture capitalist. He's a lawyer and an accountant, so he's got a breadth of experience in and out of government to help us through this. Governor, thank you for joining us.
It's great to be with you, Mark, and it's terrible that we're going through this time, but hopefully we can all learn from it and be stronger and better in the long term.
That's the idea. So let me ask you, if you think about your colleagues, the current governors of the United States, what do you see as the biggest challenges they're facing at this point in the crisis?
Yeah, well, I want to compliment governors collectively. I mean, I think they've really stepped up to the plate, and this is an unprecedented challenge. So I would say it's two or three fronts that they need to consider. First of all, a lot of it's on the communications front. They're the face of their state, and people are worried. They're scared. And I think the ones I've seen have been doing a good job of getting out, doing video town halls, figuring out different ways to, get the message out to people and give people a sense of confidence with good leadership. That's critically important. So that's one of those things people sort of set aside. But in a case like this is a big deal. And I think that's largely happening. Beyond that, there's the whole issue of how to handle the healthcare crisis itself. And God, my heart goes out to all the healthcare workers and the families affected by this with the virus and sick patients. I think they're working as hard as they can. And the challenge is we as a country and we as a world really weren't prepared for this. So we faced a lot of challenges in terms of shortages of different items that are critical to this. People never expected this to happen. The analogy I would sort of give you, Mark, is when we always did infrastructure and we'd have floods or more regular disasters, you always said, okay, this wasn't the 100-year flood because you never built your system to deal with the 100-year flood case. So this wasn't a flood, this is a pandemic, but at like the 200-year level or the 100-year level. So they're responding and they're trying, but there's a lot of things I think lessons learned coming out of this about better coordination between the states that will happen. And then economically, I think there's a lot of challenges still coming. So in addition to all the people that have suffered from a medical point of view, governors are looking at their citizens saying a lot of people were living paycheck to paycheck before. And you have this phenomenon going on now where they're not working. This is awful. This is really tough on a huge percentage of our population.
I agree with all you said, and I just want to pick up on one point, which is the question of cooperation between the governors. Quite naturally, the initial reaction for most of the governors, and I also agree with you parenthetically that I'm really impressed with how the governors are doing in most cases, was to protect their states, to get medical equipment for their states, to worry about their own states. We're now seeing through the National Governors Association an effort to cooperate. Is the model that seems to be emerging of sending personnel and equipment like ventilators to states that are hotspots and then moving it as needed. Is that a model that you think can work?
It should, and I think it's needed. Actually, I've had some discussions with some NGA kind of folks about that topic because I think that's critically important, and I think it can be done on a highly sophisticated basis, learning from the private sector on how they're managing their supply chain to do this much more efficiently. It needs to happen because the idea of sort of competing on price or availability or who you know to get things versus getting them to where they need to go most dramatically, we all need to work together. And that's going to require not just the technical answers, because I think technically it can be set up fairly simply. It's going to require the cultural issue about saying, I've got my own backyard. How do I balance protecting my own state or backyard versus saying, what can I send on to somebody else? And so that involves building trust. And so I think there's an element of additional trust. I think governors are pretty good about trusting one another. But again, you don't want to be criticized because all of a sudden you have a demand and you sent something out of state a few days before and now you're in trouble. We need to figure out how to manage that and talk through that. And I think it'd be by far the best answer if there can be some coordination on these in a better fashion. Because historically, this is the challenge we've had is historically it worked because it would be geographically restricted to who needed the help. For example, if there was a tornado or a hurricane or a disaster in one area, if you're not affected, it's not a problem sending a bunch of things. There are some great mutual aid pacts already in place, but there's never been anything to my knowledge to say it's at a 50 state level or a national level.
In terms of healthcare infrastructure, what do you think governors need to focus on now in terms of building up capacity, in terms of serving not just people with the virus, but other people who've got healthcare needs?
Yeah, that's a huge challenge. If you think about and look at the folks out there today, the COVID thing is critically important to take care of those. I actually thought the other day, I was talking to Sue, my wife, about just think if you happen to have a heart attack right now, what's going to happen? Because it's a big challenge. If you're not part of that world, then are you in trouble, extra trouble? So a lot of that's going to require going through the issues that we find through this. One of the things that you'd normally do, if this happened on a smaller scale or this was an exercise, one of the things that's standard is sort of the after action report, where I've talked to some people already, because I am trying to help through some projects on the crisis, and I've talked to people that say, you should have someone assigned that's sort of keeping track of all the issues, problems, things you're seeing, and just have them keep the list, just be a scribe. And as we come out of this, you should do an after action review where basically you go through all the positives and negatives, and there are a lot more negatives, but go through all the things you've learned to say, well, it's still fresh, to say, here are kind of the outline of the things we need to take steps to do. Because one of the problems historically as Americans, we tend to have a short memory. And we haven't historically done real well on everything from where we fight our wars to everything else about looking back in history. This is a war in some fashion. We should make sure we're doing the after action report and coming out with the outline in a collaborative fashion of the things that we can learn from.
As I said, you've got incredible private sector experience as well as having been a governor for 8 years. So if you were on a call now with all the governors and they asked you to answer this question, how would you answer it? What can we do to make us ready to reopen the economy, to reopen restaurants and hospitality and all the other business, retail, all the other things that are closed now? What would you tell them they can do now to lay the groundwork for that moment?
Yeah, a lot of it is starting to set expectations, because I still think the social distancing is the right answer. But one of the things is, as you come out of this, and we've already seen this, what are the questions you're going to get about what's okay, what's not okay, what sectors could be ramped up faster and better? Because again, this is the whole thing that we need to restart consumer demand. If you think about it, consumer demand in a lot of fields has essentially stopped. For a lot of the eating, restaurant, the hospitality world, a lot of the manufacturing world. The issue on the manufacturing side, if you don't have a customer buying your product, you can put people back in the plant, but what are they going to make if they don't have orders? So I think people need to be more thoughtful about the normal economy and the economic cycle of saying, how do you really get demand started? And supply will be there. I think the supply piece will be okay. I'm more concerned about getting expectations to say it's okay to go buy a car now or go buy a refrigerator. And the challenge we're going to have is people are going to be even more financially strapped. So this is where some of the programs, those loan programs and the other things, I believe are critically important. And I appreciate Congress and the president being proactive on those.
Yeah, and acting so quickly, even in the polarized times in which we live. In a lot of circumstances, well, in the case of states having stay-at-home orders, the federal government has not gotten involved there. They've jawboned some, but they've not ordered a national stay-at-home. That means the governors are going to be responsible for reopening their states. What would you say a governor should look to do? What are the checklist things that need to be in place before things can be reopened and people can not be under the stay-at-home orders?
Yeah, the first thing is that you have to take care of the public health issue. Again, I think the public health issue has to drive the answer more than the economic answer still, because we don't want to see this bounce back. We have to flatten the curve. We have to do all those things. But I'll give you an illustration. I was talking to some people in northern Michigan, and their economy is largely a tourism-based economy. And I said, one of the issues coming out of this, and they hadn't thought about this because they're in the crisis mode, so I brought it to them to say, how do you start? Going to your reopen question, I said, think about it from a tourism hospitality point of view. People are not going to most likely be making trips far away for some time. And I said, the other thing is they're going to be more hesitant to go to a ball game than they are to go to a campground and stay in a tent. And so for rural Michigan, I said, you should be focused in northern Michigan. You should be really focusing in on how to bring people in your surrounding areas. Look at Michigan, look at Minnesota, Wisconsin, the surrounding areas. I was talking to people in the Upper Peninsula about doing that. I said, in fact, the fact you're doing outdoor activities where it's more remote and things like that is probably a more appealing option for many people than saying you're going off to a crowded environment where you're going to have a lot of interaction.
Right.
So part of it is being thoughtful to say it's going to follow some human nature path to say, I'm going to be happy to go socialize, but I still want some space versus saying I'm going to be sitting with 40,000 people, with people sitting all around me.
Right. Or at a theme park or anything that's going to be super crowded. Is it realistic for governors to imagine opening parts of their states separately, leaving some under stay-at-home orders and some open, or is that unrealistic? They need to do it statewide?
No, I don't know the answer, because again, I'd have to say, what do the public health people say? If the public health people give it a go-ahead, you'd hope that would be the case. And again, I don't know if it could be geographies as much as, who are the highest risk people that should stay more isolated for some time, because we need to see how this works as we start socializing again.
Right. But is it politically realistic to say you people in Michigan can go out, but you people in Michigan have to stay home, whether it's geographic or by case history?
Well, I think this is where it's about trust again and common sense. Again, a governor can put out an order. Are people following it or not? With good credibility, people are going to really think hard before they decide to do something different. So I think the government still has a role there about setting some guidelines, at least, to talk about that in that context.
Lastly, Governor, what would you tell the citizens, not just of Michigan, but of the country? What can citizens do besides stay at home, besides practice distancing and wearing masks? What else would you ask people to do now?
Just help one another. And just reach out to one another. Look at how we're all doing these video events, and it's Passover. My heart goes out to, that's a family event. So people are figuring out how to do it. There's Easter coming this weekend. Are you going to do a virtual Easter egg hunt? So it's about having people share these tools. And there's been wonderful things on the news or stories and reports you see about people helping one another. And it's simple things. We originally came up to where we're at and we thought our family was going to be able to come. So we went out and bought a bunch of food. We bought a bunch of ribs for the family to eat for the weekend. And they didn't come because they said, this was before the order even came down. They said, we shouldn't be with you. We said, fine, we respect that. Thanks for thinking of us. And so I had a whole bunch of ribs. So instead of just putting them aside, Sue and I talked, we cooked all our ribs. We called our neighbors, called a couple other couples and said, if you want, we're doing takeout from the porch. So I'm not doing any sides, but we'll have a rack of ribs out on the porch that you can come pick up. And we coordinated what time so nobody would run into each other. But that's how neighbors can help neighbors. And people are doing that for us. It's those simple acts of kindness, showing we're all people together, trying to help one another.
Yeah, that's great. I'm glad you shared the ribs. And as you suggested, those kinds of things are happening countless times a day all over the country, and everybody needs to stay at it.
Yeah, this is a big thing. We need those acts. And we also remember it's time to put aside, we lost civility in our country from a political point of view, and much of our life with people yelling at one another. This is hopefully an opportunity to say, let's put that aside coming out of this and recognize we're all in this together. We don't live in a perfect world. There are issues that, everyone's had challenges during this period. Has this gone smoothly? No. But let's not dwell on the negatives. Let's learn from them, but let's come stronger together and be more as Americans and more as a world community, recognizing we have to help one another. So let's try to get, incivility down and civility up through this process.
Yeah, that's something you've talked about throughout your time in public life. Governor Rick Snyder, former governor of Michigan, joining us from Michigan. Governor, I hope you and your family have as good a time as possible under these conditions, and that you all stay safe and healthy.
You too, Mark, and I hope everyone listening to this, stay safe.
Thank you.